she ingratiated herself to the residents, so that easy to say that no resident I ever had was more appreciated than Louise Schnaufer.
Certainly among her colleagues, there was a feeling that you could always depend upon Louise.
She definitely exceeded what I expected from a physician, or even from any physician or a surgeon.
I think she was almost the mother hen to the surgical people who were already trained in adult surgery.
She was the heart of that department. I would have to say she was the heart of general surgery. She really was. She was just who she was.
She was very supportive of the nursing staff too, but I mean, her real job wasn't really to worry about the nurses. Her job really was to teach the residents and the fellows.
She guided junior residents and senior fellows through difficult and complicated surgical procedures and patient care problems.
And I think my first recollection was with her absolute commitment and persistence to seeing this really complex problem through to the end.
She is and was a very compact, energetic, down-to-earth woman, very capable, very friendly, outgoing, really very caring about the children that she took care of.
Religion had an integral place in her life, but it didn't include the fact that she was also a science person and believed in science.
So she wasn't just a female pioneer in what was then a man's world. She was a scientific surgical pioneer.
Surgeons probably make more decisions minute by minute than any other part of the medical profession. I mean, should I cut here or cut there? Should I snip this or snip that? And she suited that sort of life very well, and she was very much at home in the operating room surroundings.
Without question, her main contribution was her skill in evaluating surgical patients or potentially surgical patients, her diagnostic abilities, her empathy, which came through so loudly in her relationship with parents and family, and her ability to work closely with general surgery residents, all of whom admired her, and she was an excellent role model for them as a committed surgeon. She worked with several of the medical device companies, and they were able to come up with such a balloon, it's called now balloon manometrics, which is used to study rectal function, and it can be used in adults as well as children.
Any accolades that ever came Louise's way, what was associated with her teaching ability?
Her teaching style was to assume, first of all, that you had shown the initiative to know about the child's problem, difficulty. Secondly, to know about the disease through reading, to know something about the nature of the surgery that was needed. The advice, counsel, encouragement, and spiritual sustenance meetings in her office, which usually occurred between 5 and 6 in the afternoon, which were always accompanied by peanut butter and crackers.
She was just this very comforting person who came in, introduced herself, and explained exactly why she was there. She was not the type of physician who made you feel like she's the physician and you're the patient. She was very comforting. It was almost like talking to a family member.
You know, there's an old dictum that women have to do twice the work of men to be considered half as good. And then the answer to that is, luckily, that's not hard. And that might describe her. I think she probably had to be twice as good as the men and probably work twice as good, as much as the men. It was a totally different era. This is before the women's movement. And you felt a certain responsibility that you were forging the way and you were not going to make any mistakes because you wanted to give an easier road to the woman that came behind you. And I think she was very cognizant of that.
In working with men, first of all, she charmed them personally, but not in any subservient way. I guarantee you that, just because of her personal charm. And secondly, she was better than most of them. And in working alongside them, it became immediately obvious. I can tell you in surgery, if you're really good and better than other people, it shows. And surgeons admire that, whether or not they're women. It was the beginning of the time of the elaboration of new knowledge, the application of things to children, the understanding of embryology, the understanding of how to use multimodal therapy for tumors, the introduction of research, the versioning of educational programs. All of that she grew through. Her legacy of people who have come on to do the same thing she's doing, including women, you have to highlight that. I mean, she was her own personal role model, and she actually actively educated people. And I use that word advisedly because it's more than training. It was the whole package with her.